Good morning. I'm Claire Brindis, and I'm at the University of California, San Francisco with the National Adolescent and Young Adult Health Information Center. And it's my pleasure to add to already two very wonderful opening speakers. And I will be providing to you, hold on one second. To build on the concept of a mosaic, I'm thinking about it more like a Russian doll nested, a Lego set, a kaleidoscope, but really it's an overture. You'll be hearing a lot of themes that you'll be hearing throughout the coming 2 days. And as I was preparing, and Doug's helping me with the media, I was struck by how much attention this is beginning to get from a number of news places. For example, the Wall Street Journal on Saturday had a whole issue or a whole article on freezing eggs and the concerns around young people being concerned about how do you level the playing field when biology begins to have its ticking talk noise and sound. It was also an article on moving back home, and many of you may be surprised to know that there are now 22.6 million young adults living at home. That's a substantial increase from 10 years ago when it was only 18 million. So we are seeing a number of trends that are of increasing concern. And as Doug helps us, all right. Sorry. Thank you so much. Thanks for your patience here and to the audience listening to this across the country. So today I'm going to be focusing on providing you a brief overview, a health profile, changing context of young adulthood, milestones, trajectories, and some implications. Many of you may have seen this New York Times Magazine article several years ago that really started to raise the conversation about, is this a significant age group? Is this a stage of life that we should be paying attention to? And what are the kinds of social, organizational, policy, and practical applications of considering what we need to do to support this young adult population? So really, why are we here? There's been a significant demographic shift that I will share with you in a moment. There's an increasing body of evidence, including international comparisons, suggesting the needs of this group. And there's also this concern regarding the impact of what's been called the Odyssey, or the boomerang generation, or even the failure to launch generation. You can see that young adults have been growing over time, and now between 1990 and 2030, they increased substantially in the ages of 18 to 24, representing about 10% of the population. By 2050, they're anticipated to be about 13% of the population. And what's very interesting is to think about how diverse this population is becoming, with substantial increases in the proportion of Latinos rising about 25%. And this can be seen quite dramatically if you look at a number of maps of where the Latino population is living, not only in the hot spots or areas where traditionally we know Latinos live, but really truly all across the country. So it's not a surprise to me that we're really talking seriously about the Dreamers and the DACA. These are the deferred action children who arrived here as undocumented with their families. So why this population, and why now? We understand that throughout history and in every generation, young adults need the tools to be meaningfully engaged, caring individuals, and productively employed. That has not changed at all. But what has been changing is the changing age structure. As we baby boomers age out, we're looking at this population as those who will be helping us in the future. And not only helping us as a society, but helping us in our own families. And just as they're needed much more, there are a number of challenges to them being successful, especially true for some of the most vulnerable and marginalized populations, including those in foster care, low income, and marginalized populations. So why this population? How does health fit into the overall picture of ensuring a very successful transition from adolescence through young adulthood and from young adulthood to later adulthood? You'll be hearing a number of speakers on the major focus of health issues such as risky behaviors or chronic health conditions and how the healthcare system is changing. Clearly, there are a number of contextual factors that influence and shape health, whether it's at the individual biopsychosocial development factor or sociocultural context such as the economy, as well as policies and institutions shaping their lives. I also want to underline what Trina said about the life course perspective, because this is a very critical period in one's life. It sets the stage for the rest of your life, and critical periods related to habits that are acquired in adolescence and then continue during this age period, research that begins to demonstrate that there's an increased risk for developing chronic diseases later in life, and research on how binge drinking and heart disease may be connected. And also, this is really continuing on the adolescent years around a peak onset of chronic illnesses such as mental health. We talk a lot about milestones. The contextual change for young adulthood has really started to change these 5 major milestones that traditionally sociologists have measured this age group: the completion of school, the leaving home, the financial independence, marriage, and children. In the 1960s, 77% of women and 67% of men would have accomplished these 5 milestones within these years. In the year 2000, that number decreased to less than half of women and about a third of men. So the real question that is striking to us is this just an issue of delaying these milestones, and eventually they will accomplish them perhaps in their 30s, given that we have a much longer lifespan into our 80s and 90s? Are we so concerned about them accomplishing that in the 20s versus the 30s? Or is it the concern that they may get off kilter and never accomplish any of these, particularly around the focus of financial independence and social independence and family formation for a number of us who are concerned about whether we'll ever have grandchildren? Fortunately for me, I don't have to worry about that. I want to turn to a brief health profile. You can see that I'm using a microscope analogy here. And I want to just highlight just a few elements here around comparing Americans to those countries which are listed here that are other high-income countries. How are we doing? I'm focusing on males because they do represent a much higher proportion of those who suffer from early mortality. So in the area of transportation, the U.S. is doing worse than the average for the 16 peer countries, but not that much worse. But if you look at the issue of violent mortality, you can see the substantial contrast. And the questions are, why is it our society is so violent, and why is it particularly affecting this age population? Mortality, of course, is not the only issue. We have to really focus on issues like of morbidity. And again, as compared to other countries, and this is around both males and females, you can see that our self-reported prevalence of diabetes has grown and is substantially higher than other countries in this comparison. Let me also underline another factor that Trina raised, which has to do with the transitions between adolescents and young adults. We see that the patterns get worse, but there's a shift. For example, in adolescents between the ages of 15 to 19, 27% of all the deaths are related to the issue of motor vehicles accidents. But in the years 20 to 24, that shift occurs to all other unintentional injuries. And when I just talked about the transitions of adolescence into adulthood, then I also want to talk about the transitions of young adulthood to later adulthood. So here is an example of obesity with about 20% of young people between the ages of 18 to 25 who are obese. increasingly reaching up to 33% and 31% later in adulthood. We also have to think about other types of chronic health conditions. And here, mental health and substance abuse are just highlighted. You'll be hearing a lot more in the next couple of days on these factors. But there are also not only the issues of transition and life course, but substantial gender differences that we need to be thinking about. So, for example, under serious psychological distress or major depressive episodes, you'll see that females experience this at a much higher level than males. But then in terms of alcohol abuse and dependence or drug abuse, males tend to be higher than females. I'm not going to give specific numbers. I just want to give you an impression of trends in these slides. The one area, of course, that women do and men can't do so far is the unplanned pregnancies. And in 2008, there were nearly 2 million pregnancies to unmarried women. 1.3 million of those were unplanned, about 70% of them. And again, the very young adult, between 20 to 24, has a higher incidence of that than the 25 to 29-year-old, where it goes from 102 per thousand to 84 per thousand. And roughly half of these unintended pregnancies will end up in an abortion. So we need to highlight the fact that the healthcare system that's been established often has a number of shortcomings. It fails in a number of ways. One is that the financial system changes substantially, and we hope that with the Accountable Care Act that this will be changing dramatically. We still have a system that has perverse incentives, that we reward for acute care over preventive care. And we need to understand that we also, even today, even before the ACA's implementation, we have a shortage of providers, particularly in the area of mental health, that is not adequately prepared to deal with a number of these issues. And finally, there's very little consensus on really what are the healthcare needs of these young adults. So with the ACA that you'll be hearing about tomorrow, there is promise that this population will definitely improve in their health status. About over 3 million young adults have already been successful products of the fact that the ACA has been implemented with the expansion of coverage up to age 26 for those families that have health insurance. There is also great promise of Medicaid expansion. Many young adults who in the past have represented a third of all the uninsured who were not covered previously have the promise of being covered if they live in a state where there will be Medicaid expansion. And hopefully, with these different health benefit packages, with the idea of medical homes, with the idea of eliminating cost sharing for certain preventive health services, we will begin to make some inroads in the kinds of health conditions and health issues that cover this group. I want to quickly move now to the changing context for young adulthood and focus a little bit on the post-industrial society, employment and other pathways, marriage and family formation, as well as the role of social technology. So before this 1960, over 80% of the jobs were in industry and manufacturing. You can see now, though, how different these trends are, with a substantial decline in agriculture and a substantial increase in the area of education and health and in financial activities. So traditional pathways to adulthood, where you could have gotten a good, well-paying, meaningful job with a high school degree, are very far and few. So that entry pathway into occupation makes a very substantial impact on what kinds of opportunities exist for young people. Now, almost 80% are working either in an office or a service environment. There's also been quite a revolution, as many of you are aware, of the change in the workforce with the doubling of women working in jobs between 1948 and 2009. And we see here the tremendous necessity in this very high-tech world to have at least 4 years of college to be eligible for even some traditionally basic kinds of positions. So for those who have less than a high school degree, which is shown in the blue line here, their proportion of the workforce, their distribution, is substantially lessened because of the reduced numbers of opportunities, decreasing from about 36% of all the jobs to about 8.7% of the jobs available. So, just a brief quiz for you here and out there in the web world. In 2012, what percentage of young men ages 25 to 29 completed college degrees? What percent of women? Choice A, and I would like you to raise your hand. 16% for men, 28% for women. Choice 2 is 30% for men, 37% for women. Choice 3 is 36% for men and 38% for women, and 42% for men and 49% for women. The answer is B, 30% of men and 37% of women. The next question, briefly, is in what year did females begin college at a higher rate? At what year did females begin completing college at a higher rate than men? A is 1986, hands raised, 1989, 1991, and 1995. The answer is 1991, as shown in this slide, where you can see in the early 90s this shift of women participating and completing college at a higher rate than men. The challenge now is what will happen with all these 1.8 graduates that are about to look for jobs in this coming economy, who are now increasing the numbers of other young people who already are unemployed and looking for work. And yet the trends are becoming more positive. So in 2003, almost 8% were unemployed, peaking in 2010, and now dropping to about 9.42% of young adults. And yet what's sobering about what's happening with the types of educational and economic and employment opportunities for young people is how limited economic mobility has become, with almost 2/3 of those raised in the bottom of the wealth ladder remaining there, while 2/3 of those raised in the top staying at the top rungs. Let's move really quickly to social media for a moment. And this is not any surprise to anyone listening to this presentation, with the dramatic internet use over time by teens and adults. This is true really about all ages in our country. And what you'll be learning about more in the next couple of days is we don't know enough yet about what the impact is of all of this social media and what kinds of communities are developing. Certainly, a large proportion are relying on Facebook, using social networks, but also using Twitter, Instagram, Pinterest, Tumblr. And every product that emerges, there is a tremendous interest in using social media for communication, for self-definition, for sense of community. I want to now move into milestones. And I think that a very major concern is among those parents that I mentioned earlier, with about 22.5 million young adults living with their families, and for what kind of impact there is on the family when this occurs. An element that has been brought to my attention as I was doing background work, of course you talk to a number of people, including your own children, is the challenge of decision-making. So it used to be that in the past, the choices that you had available, let's say you went to a restaurant, you had a limited number of choices. Now when you go to a restaurant, you often find that you get almost a telephone book size of menu choices. And if the equivalent analogy is that for a lot of young people who are facing the freedom of having so many choices, the fear of making the wrong choice. Because making that choice will require a certain level of commitment. And as my son Daniel shared with me, there's a sense of compounding those options that you didn't take. The road not taken can sometimes feel overwhelming. And as a result, a lot of young people are frozen in their ability to make decisions about moving forward. I mentioned earlier that women are graduating from college, but I also want to say that the good news is that there's been an increase in the number of young adults who are enrolled in school by gender. So, for example, to highlight the African American population, in 1970, which is the blue line, there were 40% who were enrolled in school among males, going up to 49% in 2007. For females, it increased from 37% to 56%. And we see also that there are tremendous differences, not only by gender, by race. And the purple line here are the Asian populations. And the reason why there's no additional data on Asians is that data on that group was only begun to be collected in the early 2000s. So you can see tremendous differences, but also increases across all racial and ethnic lines. But when you again separate out by gender, for example, when you look at Latina females, 17.4% have completed a 4-year degree if you're a female, and 12.5% if you're a Latino male. So again, lots of disparities that are occurring among these populations, both by ethnicity and by age. One more quiz for the group. What percent of young adults say that they live at home with their parents because of the economy? 20%, 30%, 40%, or 50%? So we have the right answer is about 40%. And again, the concerns are this is sort of uncharted territory and has implications also on the parents as well as the families. And for younger families, we often talk about, are these the helicopter parents? Are these the lawnmower parents? Is there a certain level of codependence? But the more that you talk to people, a lot of it really has to do with economics and surviving. So in terms of milestones living at home, the boomerang generation are staying closest to home with a substantial number in the 18 to 24-year-olds as well as the 25 to 29-year-olds. So across all young adults, it's about 39%. Financial independence is also something that I've mentioned earlier, and that is the financial tides vary tremendously with age. And when young adults were asked about their financial situation and how it's linked to their parents' financial situation, whether it's a great deal or some, again, not surprising that among the 25 to 29-year-olds, 60% of them express that they're linked to their parents. But I think something that we need to also consider as we talk about the younger adults is there a spillover effect on the 30 to 34-year-olds as well? Let me move now into family formation, the milestone of family and marriage. Marriage by education level has also been changing, with all college graduates, an increasing number who are reporting that they have never married. But a point here on this chart really is the clustering of how it doesn't almost matter what your educational level is, it's the increase in the number of young people who never marry. And again, we see changes or differences by race and ethnicity, with African Americans having the highest proportion reporting that they've never been married at 44%, and among whites rising to 23%, with Latinos in between with 34%. When we also think about the percent of all births to women ages 20 to 24 that were to unmarried women in terms of childbearing, you can see also that it's increased dramatically from about 5% to 63%. And again, racial and ethnic background differentiates many of the outcomes. But even here, the trends are going up. And the percentage of non-marital births by education also shows a relationship, even though here, those individuals without advanced degrees, those with a high school degree, which is the green line, have a substantially larger number who are never married and who have children. So overall, by the age of 25, 44% of women have had a baby and 38% have been married. And the question is, what does this mean for us? What is the implications for society? What are the implications for early childhood development, etc.? Now, Oops, sorry. I wanted to just make a point about trajectories, and I'm only going to highlight 3 trajectories because over the next 2 days we will talk about many different kinds of trajectories. The one point I really want to hit home on is there are many, many different pathways. It's a very non-linear world. And what we find are that people may drop out for a while from a job, go back to school, perhaps to go on the military, perhaps go to college, perhaps be a parent. But there are many, many different pathways, and this is what's intriguing to us as to what the outcomes will be for individuals. One big change that has happened that I want to highlight among Latinas is that there's been a substantial reduction in the numbers who are mothers only, decreasing between 1970 and the year 2007 from 39% to 18%, with similar patterns among blacks and whites. And across all ethnic and racial groups, a doubling of women indicating that they're going to school only, without working or without having a child. If we focus briefly on the military, we can see also that there's been substantial changes among all ethnic and racial groups between 1970 and the year 2007. So as an example, among whites, it's decreased from 11% to about 2% between those years. But among Latinos, it's gone from 2% to 7% for native-born Latinos, and from about 1% to 6%. So as you'll hear tomorrow or later today, more and more the military represents an important conduit towards young adulthood because oftentimes there are lack of other types of opportunities. Another type of trajectory pertains to incarceration, and the numbers of males incarcerated by race also has seen some positive directions in terms of a decrease, for example, among blacks, where there was 9% in the year 1970, decreasing to about 5% in the year 2007. So moving quickly to implications. Clearly from my talk, I want to highlight that demographics will play and is playing a very important role, both in terms of gender and racial and ethnic disparities, tremendous variability among and across these special groups in different geographical parts of our country. There's a substantial increase in the number of Latinos whose closing of the educational gap will be very important, but it appears to impact and affect females more than males, which I think is important for us to consider. If we think about pipeline choices for these young people, we need to recognize the interacting synergies that exist between age and gender and race and ethnicity and opportunities, as well as thinking about how do we help young people navigate this sense of limitless number of pathways. At times, for those young people who are middle and upper class, this can be challenging, but also for underrepresented minority groups and for poor, low-income populations, those life options are often much, much more narrow in scope. And we need to be thinking about pipeline education and employment options that need to be established to enable youth at different points in their lives in the runway to get on and off as they seek more advanced education and training. And as we talk about education and training, we need to be thinking about how does the economic environment impact those life choices? In spite of the fact that many young people have educational achievements, are they able to accomplish those kinds of milestones that have traditionally been seen as the way that we define a successful achievement of adulthood? So for policymakers who will be facing a number of these issues, we need to understand about economic disparities, educational and employment opportunities for the underserved, particularly males representing diverse ethnic groups, will likely need to be prioritized in this very competitive economic field. And finally, we need to be thinking about the extended educational training requirements that bumps the progression towards marriage and family formation. Gender clearly is having a different impact upon the choices that young adults select, and the social policies related to training programs, for example, post-military, advanced long-distance learning, paternal leave, will likely continue to impact what we define as traditional gender roles, in turn further impacting family formation. So I want to thank my fellow researchers at UC San Francisco who helped me with this presentation, and also to really acknowledge the leadership of Trina Anglin, who's done so much for advancing the cause of really defining not only what happens with adolescents and now into the next decades. Thank you very much.